Hey, this is Dr. Yates, and we're just having a post-op visit with one of my patients, and it's been about a year since we did FUE surgery. And the good thing about Rick here is that he had had a procedure before us where he had a strip. Now, those are the best patients to give the benefit of FUE, because say if somebody never had FUE before and you tell them, hey, it's better, less pain, less scarring, less this, less that, they'll be, well, maybe, maybe not. But the patient who's had a strip before, they know the difference. So Rick's in for his 1-year checkup, and before I introduce you to him, I want to say that he had 1,500 grafts to the frontal scalp, and I'll show you some pictures about that. So first, Rick, how's it been going?
I've been doing well. I'm happy, and I think my
hair
well, it speaks for itself. I'm excited about it.
Okay. So as I usually do, and people have seen us on YouTube, we always show the before pictures to make sure that number one, this is indeed the patient and they agree, and we'll take it from there. So Rick, I want to show you a couple photos here. Let's see. First I want to show the camera. Can we come in on this one? The best you can. Okay. So we want to see, and what I want to, and I'm going to show it to you in a second, Rick. I don't want to do spoiler alert. I want to show you the disorganization of the hair in the front. That's what happens when you thin. It's just disorganized, like crabgrass. So just putting hair there, 1,500 grafts, gives organization, permanent organization, because that hair doesn't fall out. So I'm going to pass it to Rick and say, hey Rick, is this you? If it's not you, Rick, you tell me.
Yeah, that's me.
That's you.
Unfortunately, that was me.
Okay. So what do you think of that picture?
I had no. I guess you get used to your own profile and how you look. I didn't know I was that thin, or I didn't have a frontal hairline.
Right. I mean, you can see your scalp here is really no organization there at all. But you still were good looking.
Well, thank you.
We'll say that for the record. He still looked good, but there's always room for improvement.
Yeah.
So let's come in on this picture here. We always take pictures after we put the grafts in, and for those who don't like to see a little bit of blood, I'm sorry, but it's not that much. But you can see we packed the grafts in this frontal 1/3, 1,500 grafts. Now the other thing I'm going to say that's been good about Rick is he's been faithful to red light laser. We're a big believer in using laser light after having a hair procedure. One, because I think it accelerates the growth of the grafts. Two, I think it slows down the loss of the natural non-grafted hair. So I know I've talked a lot, Rick, so you can tell me, say, comparing the procedure that you had before with the strip in the back to this, how would you even describe it? If I were a patient, I'd say, how is the old one compared to what Dr. Yates did to you?
Sure. I would have to say that the procedure I had a year ago was with you,
right,
with Dr. Yates, was very comfortable. Recovery was very easy. I was in no pain. Now if I compare that to previous, I just remember with the strip it was painful, and there were stitches and sutures and you had to come back for that, and the recovery was a lot longer. I just think after your procedure, I was on a Saturday, I went to work on a Monday, felt good. I mean, I was faithful in coming in and doing the light treatment.
The light, and that's important, because I think that helps. A lot of people think that the red light is hocus pocus. I'm here to say it is not. It's FDA cleared with the right amount of diodes. All red lights aren't created equal, so you have to get the right one, and we could talk about that on another video. But I think the red light has really helped his progress.
I would recommend. I mean, without any, if someone was asked me to compare the two differences, what would you do? There's no doubt I would recommend the FUE procedure that you did, just because how easy it was. I mean, literally, drove myself home. Recovery, was able to go back to playing tennis. I played competitively, within 10 days, and felt good. I really think the recovery time in the FUE is amazing.
I would agree. Now let's look at his hair. Now, as my grandmother said, the proof's in the pudding. Okay, look at the pudding up here. This is, you know, all his natural hair, just like you see on those commercials at 3 in the morning. This is all his natural flowing hair, okay? So he can style it, he can do whatever he wants with his hair.
I like it.
There you go, do like they do at 3 in the morning. Do
I
that.
like it.
Oh,
I like
we don't have any wine for him or any ladies, or we're not near a pool, but, you know, with, you know, just imagine, you know, that's his natural, real hair.
My hair, it's awesome.
Yeah, it's wonderful. So the key that we stress here is that naturalness will trump density, meaning that you want your hair to look natural. And I bet no one has said anything to you other than maybe you look more in shape or younger, or has anybody said anything?
The only thing, you know, something's different, but nobody goes out of their way and said, well, they say, did you get a new haircut, or
Right.
you know, did you get something like that? But nobody
Right.
has come out and said, you look. You know,
Right, like you did something to your hair.
No, nothing, not at all. I think it's, is it a different style? Are you wearing it longer? I think that's what you hear more. You know, I like that.
Okay.
And, you know, I get from the family is who I hear it the most from, because they're probably the most honest.
Right.
24 and 28-year-old daughter, they give you pretty good feedback.
Yes, yeah, brutally honest, you know. So, to wrap it up today, you know, Rick, I gotta say I'm pleased with your product, your process and your progress, I mean to say. And I love the way it looks. It's very natural. Who's ever styling your hair is doing a great job too. And here we strive just to give each patient the best product that we can give. And every hair transplant is different. Like people who are watching this video, they'll say, oh, my hair is not that bad. I don't need 1,500 grafts. Maybe I need 300 grafts. Well, you can't make that decision until you come in and actually see a doctor, and the doctor looks at you and does whatever method he or she does to figure out how many grafts you need. So we'll be happy to see you or take any questions here in Chicago. This is Dr. Yates. See you.